Good afternoon. I'm Donna Hefner, the Chief Executive Officer and President of CRV Medical Center, coming to you live from CRV Medical Center in my first live Facebook feed. I just wanted to reach out to our community and to our staff and first and foremost say thank you to all of our employees and our medical staff and our leaders who have been working tirelessly for the last 30 days in regards to implementing these strategies to reduce our exposure of this pandemic in our community, as well as to care for those in need of our healthcare services. I just wanted to acknowledge those individuals as we continue to push forward in taking care of our loved ones and our friends here in Porterville, California. We are indebted to our community for the outpouring support that you have given us. We have received several donations from our community members and businesses related to N95 masks, as well as gowns, food donations, and various other items, and we can't thank you enough for all of that love and support and continued prayers and well wishes. They mean a lot to us in this time. So we also would like to take a moment and just thank the staff for leaning on each other and giving us as leaders feedback in strategies and things to consider as we have layered through the last 30 days of implementing stricter restrictions around visitation, and we know that's been a huge impact to our community and to our loved ones in really trusting us with your loved one to take care of them and give you good communication back of how they're recovering from their illness, and we thank you for that support and working with us. And our medical staff have implemented virtual visits in most of their offices, and thank you to our PCPs, our providers in the community who continue to take care of the patients and give them guidance and reassurance. So let's talk a little bit about what some of the issues are here in Porterville and from our community standpoint. We've been working very closely with Tulare County Public Health Department, who has been a valuable resource to us. We're in constant communication 7 days a week since March 11th, and had very open communication with them in regards to the issues that we've been addressing. As a result of that, we have moved through this time period in providing more and more information to our community. So with that is one of the things that's been really at the forefront is how do we know a person is confirmed positive? And it starts with our opening of the collection drive-through testing site here in our medical office building, and we have collected over 125 specimens which were sent to the county under the county's format, and as a result of that, they perform the testing analysis and provide the communication back to the individual related to a confirmation of negative or positive. In regards to specifically just our collections, we have had 116 individuals that have tested negative, and that's always a good day. We have had 9 individuals test positive in our community. And so as a result of that, we will continue our efforts working with our primary care providers in regards to that screening of patients who are in need that are presenting with the symptoms of COVID-19, which is fever and cough, and just to name a couple. But as a result of that interaction with the PCP and the public health department, once a individual is given what they call a PUI number, they present to our medical office building drive-through testing collection site, and we will collect the specimen and send it to the county for that analysis. So that has really been a key component to our command center activities in helping with that collaboration and making sure we have good communication. Secondly, I'd like to talk about our safety of our providers, really near and most at my heart in regards to how are we doing with ensuring our nurses, physicians, patient access, registration, dietary, respiratory. How are we keeping those our employees safe? And so some of the things that we have been doing day in, day out is around what we call personal protective equipment, the PPE, we refer to it in healthcare. And so we have various items that are really essential, and I say essential is because they are the barrier in which a person who presents for our services, if they are exhibiting symptoms out in front of the emergency department in the triage tent, they are placed with a surgical mask, which is a face covering that's hospital grade surgical mask. Is placed on the individual, but the person that you're interacting with is wearing an N95 mask, which is the most important personal protective equipment to be used, as well as some will be wearing a face shield, as well as a isolation gown or a type of protective gown. So those have been essential items. We have seen an outpouring of support around making face shields for us as we had a supply that was becoming critically low. We had several donations over the last week and 2 weeks that have been very helpful. So our personal protective equipment has been very much in fluctuation, but based on the last 2 weeks of our utilization, and looking at what we call a burn rate, which is a burn rate is equivalent to looking at how much personal protective equipment have we used compared to what our needs have been. And so as a result of using CDC guidelines around extended wear, we have projected that we have the PPE that we need based on the last 2 weeks of volume for the next couple weeks. But that said, that is various stages because we have gloves and gowns and face shields and N95 masks. So those are something I wanted to come out specifically and talk to you about. The one critical element to what we're faced with today and in the last 2 days has been around wipes. The wipes are what we use to disinfect our equipment, our gurneys, our various surface spaces that we are touching. And as you can imagine, that is very difficult to even purchase for your own home. So those have become critical in the last 2 days for us, and so we've had to go to a more, not a ready-made wipe, but move towards a solution, disinfectant solution that is changed every 2 hours and placed in a spray bottle that is sprayed on a cloth. So I just say to you, that, although PPE and disinfecting wipes, are at various times in a shortage, and we'll find other ways. We reach out daily to our Mohawk at the county to give them an inventory, not only at the local but the state level, to communicate what our needs are. But we are also exploring many other commercial avenues using our materials management team to find other ways of procuring these items. So that day, every day, it changes for us, and I just underscore the community's support of dropping off things for us, have been put into use and deployed to the units to where the staff are putting those items on. So I thank you again for all that support. So last, I'd just like to just highlight really in regards to here in our healthcare district, which spans from Strathmore to Terabella to Springville and all of the Porterville zip codes, right? So really what has helped us the most is really your adherence to the guidelines and recommendations. The 6 foot social, we used to refer to social distancing, but the physical distancing that you're doing, being 6 feet apart, has really slowed slowed down the transmission of this. And also I just wanted to really emphasize that going into this holiday weekend of how important it is for you to be vigilant in regards to this. And I know how difficult it has been on being away from family and loved ones, and just being able to give them a hug. And so I just really like to emphasize, please adhere to those guidelines for the no gatherings, the 6-foot physical distancing, and find ways to socially connect. So meaning that, use this FaceTime, use your phones to connect with individuals, and even though you might be sitting down with your immediate family for dinner, but call out to your family and have them join you by phone and various ways to connect with them. And so I just want to really reemphasize to make sure you cover your coughs and sneezes. If you are running a fever, please call your primary care. You're also welcome to call us here through our hotline, and we want to just encourage you to continue to cover your coughs and your sneezes, stay at home, be vigilant about your hand washing, and really that's really probably the most important thing that you can do personally to help all of us to be able to be here for you.